I'm Dr. Manuel Castro. I'm a bariatric surgeon. I've been in practice with bariatric surgery for almost 20 years, and currently I practice at Methodist Charlton Medical Center. Obesity is a chronic condition that is associated with multiple other medical problems, problems such as diabetes, high blood pressure, sleep apnea. The problem with obesity is it not only affects health, it also affects quality of life. The excess weight limits people's ability to perform the normal activities of everyday living, and therefore their quality of life suffers significantly as a result. As everybody notices, obesity has become a more significant problem over the last few decades, and multiple factors account for this. We have a very strong environment that favors development of obesity. We also are genetically predisposed to obesity, and that is a very difficult problem to address. But we also have emotional issues. Many of us take medications that contribute to excess weight as well. Our bodies control weight within a fairly close range, not too different than the way our bodies control our body temperature. So for a number of reasons that we discussed before, this weight control mechanism can be reset at a higher level, and for that reason it becomes very difficult for people to control their weight once their weight is reset at a higher level. What happens, patients may try diet and exercise, and as they lose some weight within a few short weeks, the weight returns simply because the body fights to stay at that higher level. There are multiple medical problems related to obesity. Some of the more serious ones include diabetes, especially the adult type of diabetes. Also, we have problems such as sleep apnea, hypertension. We have coronary artery disease or other atherosclerotic diseases of the peripheral circulation. We have multiple cancers that are related to obesity, specifically in women, breast cancer and uterine cancer. In men, cancer of the colon, cancer of the prostate are more common in obese people. We also have other inflammatory conditions that can be exacerbated by obesity. We have also the mechanical effects of obesity as well, such as problems with premature wear and tear in the joints, early osteoarthritis that really affects quality of life. Also, the increased pressure in the abdomen leads to problems such as gastroesophageal reflux, problems with circulation in the lower extremities such as swollen legs or hernias. So there are multiple problems related to obesity, and these keep increasing as this obesity gets more severe. We utilize body mass index as the basis of determining whether somebody is a good candidate for surgery. And body mass index is simply the weight of the person divided by the height. This can be seen or calculated in our website quite easily just by entering those two numbers. Body mass index over 40 qualifies a person for weight loss surgery without any other serious medical problems, whereas a body mass index of 35 or higher, if that person has a serious medical issue such as diabetes, high blood pressure, sleep apnea, or heart disease, that person may qualify for surgery as well. The more important factor, however, is the person's ability to be committed to a lifelong change in their lifestyle, and that in general would make the person the best candidate. Yeah, there are multiple operations these days utilized to help patients control their weight. From the least invasive, which include stomach or gastric balloons, These generally are indicated for people that need to lose only a few pounds, and they're temporary measures, to more permanent measures such as gastric sleeve surgery or gastric bypass, or the most complex such as duodenal switch. These operations are widely available, and discussing the pros and cons of them with your surgeon will give you a better idea of what operation is best for you. Weight loss procedures carry with them a number of potential risks. The risks can be classified as early complications or late problems. The early risks include problems such as the potential for infection or bleeding, the possibility of blood clot formation in the lower extremities, the possibility of leaks at staple lines, and also the potential for internal organ injuries. Long-term effects of these operations are mainly problems with nutritional issues. There can be gastritis or ulcers, in particular those related to gastric bypass. There can be also the potential for internal hernias or gallbladder disease. The two most important benefits that patients look after with weight loss surgery include number one, the improvement in medical problems related to obesity. Problems such as diabetes can dramatically improve right after the operation. Problems such as arthritis can improve the quality of life of patients also quite significantly. Sleep apnea goes away in 3/4 of patients. High blood pressure may be better controlled or potentially go away completely. The potential risk for cancers goes down as well. And the second major problem is going to be quality of life. Many patients, especially after a certain age, they want improved quality of life. That excess weight has really impinged on their lives. Approximately 20 years ago, we used to think that weight loss surgery was the end-all of the weight problem for patients. However, as we have learned more and more about obesity, we know that this is a chronic condition that is not cured by weight loss surgery alone. So in order to have a good weight control for the long term, patients need to be attentive to their weight on a continuous basis following surgery. And having a constant attention not only by them but also by other healthcare professionals, hopefully they will keep their weight under better control over the decades to come. That is a very common concern of all of our patients, and unfortunately excess weight is going to lead to overstretching of the skin. The skin is a very elastic organ. It's going to retract quite a bit as people lose weight, but after overstretching, not all of it is going to return back to normal. So we expect some excess skin on some of our patients, and discussing that with your surgeon will help you have an idea whether that will be a serious problem down the road or not.